Hello, my name is Dr. Javier Ruiz, and I'm a medical oncologist and hematologist at Montefiore St. Luke's Cornwall Hospital. And today I want to talk to you about risks of lung cancer and screening guidelines. How common is lung cancer? Lung cancer is the second most common cancer in both men and women. It's the leading cause of cancer-related death among men and women. 1.6 million deaths worldwide. In U.S., 234,000 new cases diagnosed yearly, with 154,000 deaths. Lung cancer accounts for 1 in 4 cancer deaths each year. What is lung cancer? Well, lung cancer is a cancer that starts in the lungs. Lung cancers are thought to develop over many years. To understand lung cancer, it is important to understand the structure of the lungs and how they work. The lungs are 2 sponge-like organs found in the chest. When you breathe in, air enters through your mouth or nose and goes into your lungs through the trachea, which is the windpipe. Let's talk about the types of lung cancer. There are 2 major types of lung cancer: small cell lung cancer or non-small cell lung cancer. 85 to 90% of lung cancers are non-small cell lung cancer. If a lung cancer has characteristics of both types, it is called a mixed small cell / large cell cancer. This is not common. Let's talk now about the causes of lung cancer. Smoking is the leading cause of lung cancer. 85 to 90% of lung cancer cases are smoke-related, either direct or secondhand. There are other known causes of lung cancer, but they are much less common. A small percentage of lung cancers occur in people with no risk factors. Risk factors are anything that can increase or decrease a person's chance of getting a disease such as cancer. There are many known risk factors for lung cancer. Some of these cannot be changed, but some can. Let's talk a bit more about lung cancer risk factors. As we mentioned before, tobacco smoke is a big one. Smoking is the leading risk factor for lung cancer. Smoking rate in U.S. is 15% despite efforts to increase awareness. Cigar smoking and pipe smoking also increase the risk for lung cancer. Second-hand smoke is a risk factor. Breathing in smoke from others or the environment can act as a risk factor. Hookah smoking, popular among young adults. Hookah smoke contains some cancer-causing substances as cigarettes. Radon, the naturally occurring radioactive gas that results from the breakdown of uranium in soil and rocks, is a risk factor. Asbestos is a risk factor. Also arsenic, radiation therapy to the chest, and other cancer-causing agents in the workplace can work as a risk factor. Well, now, what can you do to prevent lung cancer? There is no sure way to prevent lung cancer. However, there are things everyone can do to reduce the risk. First and foremost, do not smoke and avoid breathing in other people's smoke. Reduce or eliminate radiation exposure. Follow a healthy diet. Avoid exposure to known cancer-causing chemicals. Now let's talk about lung cancer screening. Screening is the use of tests or exams to find a disease in people without symptoms of that disease. At Montefiore St. Luke's Cornwall Hospital, they have a lung cancer screening program with using a low-dose CT scan. They have also an early lung cancer action program, which include free lung cancer screenings. So who qualifies for these free lung cancer screenings? If you're a current smoker between the ages of 55 to 77, a smoker of 20 years or more, a former smoker who has quit in the past 15 years, you may qualify. To learn more about the Early Lung Cancer Action Program, call the Littman Cancer Center Oncology Navigator at 845-568-2011. Now, in terms of lung cancer treatment, there are several types of treatments that are available. And it really depends on the stage and the type of lung cancer the patient has. It may involve surgery, it may involve radiation therapy, or chemotherapy, or a combination of radiation and chemotherapy, or the combination of also surgery, radiation, or chemotherapy. Targeted therapy is now also available for lung cancer. So lung cancer is usually treated with a combination of therapies. So it's what we call a multidisciplinary approach. I hope this was helpful.